Sure. I talked about radiosurgery for trigeminal neuralgia, which is the most popular indication in the functional neurosurgery field. We treat these patients when they don't respond well to medication or when they cannot tolerate the side effects of the medication. In those circumstances, they are eligible for a surgical procedure, and radiosurgery is the minimally invasive among all of them. So it's very attractive because it doesn't require the patient to be admitted to the hospital, and the complication profile, it's basically facial hypoesthesia. It's way more rare to have eye dry or tingling in the face or anesthesia dolorosa by this procedure. The other procedures may lead to more complications, and it's very important to discuss when we should indicate radiosurgery for TRIGEM and which are the results. If we compare with a more invasive technique, that's the microvascular decompression, the results are not as good as with the open surgery in the long run. However, the risks are much smaller and the patient can resume to work the following day of treatment. So that's basically the point I try to do, and then I discuss a lot about the nuances of the different radiosurgery protocols of where to place the isocenter, which is the dose range that you can use, the different attempts to improve results by increasing the length of the nerve treated, why we currently treat with the protocol that we use, the importance of the technique, the importance of knowing of your team, knowing what is necessary to deliver a safe treatment, since we are using a very high dose of radiation in someone who has a benign disease and to a very small target. So we are giving 90 gray or some dose ranging from 80 to 90 with a 4 millimeter collimator to a structure that measures 3 millimeters. So we gotta be very cautious. And I also made the point that we can use different devices if they are proper to achieve the goal I just said before. But you need to have your team together, and you need to design your treatment protocol very strictly and follow it so it can be performed in a safe way. I'm very honored to be invited to be here because this center is known, very well known in the world. I heard about this when I was living in Los Angeles, and since I am in Brazil, it's the third or fourth time I come to Mexico to invited as a speaker, and it's the first time here in the Institute. So it's really nice to be able to be here, to know I have colleagues from here that I admire. You are a center of excellence. It's not because I'm here invited by this event, but it's really one important, very important center in Latin America, and unfortunately we have very few centers that we can name such as this one.